Healthcare experts say new federal rules meant to make medical costs more transparent instead created widespread confusion. This month, the Centers for Medicare and Medicaid Services began requiring hospitals to post all their prices online. Critics say the information is difficult to understand and the prices themselves are misleading. Anna Werner is taking a closer look at those price lists. Anna, what did you find?
Well, good morning. You know, anyone who's ever received a hospital bill knows how complicated they can be. The new government rules were supposed to demystify hospital prices. But 3 weeks after it went into effect, patient advocates say people are now coming down with a case of too much information.
I was very worried that I was going to end up not only in pain in my back, but also in my wallet.
When Christopher George injured his back last year, a doctor told him to get 2 x-rays. A friend told him about the price checker service at St. Luke's University Health Network in Pennsylvania, where George learned he could prepay for his x-rays for about $100 each.
That's why I went there. I knew what I was paying for the first time medically.
But experiences like his are rare. A new government rule requiring hospitals to post price lists was designed to help patients figure out how much they would be charged. The master price list went up earlier this month. But those spreadsheets often contain more than 10,000 items, with names that resemble medical gobbledygook. We found something called an SCSP RPLC PICC. Don't know what it is, but it's priced at about $8,500. Jeannie Pinder runs a website called Clear Health Costs, where consumers can look up medical prices.
It's not comprehensible to the average human being.
So you look at this string of letters and numbers. What's that?
No idea. And I do this for a living, actually, and I'm confused by it.
At one New York hospital, there are 3 different listings for something called ear, priced at $48,000 to $110,000. There are 5 more listings for other ear, procedures costing from $27,000 to more than $150,000. Or maybe you need a procedure involving a stent, but would you be able to pick out the one your doctors might use from this Florida hospital's price list? Is it the one listed at $5,400 or the one that costs nearly 9 times that? What's more, Pinder says the prices aren't real.
They're fanciful, they're inflated.
Explain that.
So hospitals have a list price that's very much like the manufacturer's suggested retail price for electronics or a list price for a car. Very rarely is the hospital ever paid that actual list price.
That's because those list prices don't take into account the huge discounts negotiated by Medicare and private insurers, which are considered trade secrets. Pinder worries patients may be misled about their actual out-of-pocket costs.
You might find this wildly inflated list price and decide that you can't afford it and choose not to get treatment.
Francine Botek, a senior vice president at St. Luke's, believes releasing price lists is a step in the right direction. But she also says hospitals need to do a better job helping patients understand that information.
This is the direction healthcare needs to go. If hospitals were doing what St. Luke's is doing and offering transparency tools, patients truly would be able to do price shopping and they would be able to compare.
So there are no uniform naming standards. The other thing is if you want to compare prices between hospitals, that would be very hard to do. They all call it something different, but it's not all hopeless. Jeannie Pinder says there are a few things you can do. First, ask for the medical code. That will help you zero in on the actual item on the price list. Ask if there are other charges like surgical room rates or medications or additional tests. Also, you can ask how much will it cost with insurance and without. Ask about the cash price. You might save money. And finally, if you can, get everything in writing.
There has to be transparency.
Yes.
Yeah. In what other part of our lives would we buy something or get a service and not know how much it costs? The secrecy allows for high costs. It allows for people to make profits at other people's expense. I know it's hard now, but I hope this transparency pushes change. We have to have knowledge about what stuff costs in our health care. Yeah. It's the only way to get healthier and to get better prices.
Yeah, too many people don't know what anything costs.
And then when you get the bill, it's so darn confusing. I don't even know what they're talking about.
Yeah.
It's not, it doesn't even seem in English to me.
And kudos to this administration's FDA. Scott Gottlieb was mandating that drug prices be advertised on commercials as well. So again, once again, promoting transparency for consumers.
Right. Should I say more of how I feel?
I was going to say, how do you feel wonderful, Norah O'Donnell. We need to send your report to somebody.
Yeah, it's really good.
Seriously,
You always do the best reports, Anna.
Well,
You
thank
really
very
do.
much. Well, hopefully this will help some people with some tips.
Keep it coming.
Thank you, Anna.
Really good.
Thank you.